talking about quality today, but first, I know you guys have a group project coming up soon, so I want to talk about some stuff before we get into our lecture today. Yes, ma'am.
I just have a question. Can you go back on your PowerPoint? Like, can you click one space back?
Go back to what? The
The
hospital?
page, yeah, like the page you had before that. Is that like how you want our PowerPoint to look for our group project?
We're going to talk about it a little bit. So I'm going to go over some things that I want to see, some things I don't want to see. Ms. White, can you read that? You can?
Yeah, I get what you're talking
When you're doing your presentations, you want to make sure that it's easy to read. What that means is you want to make sure that the font is large enough for somebody, whoever might be sitting all the way in the back, to be able to read it. Not only that, you also want to make sure it's a font that's readable, so nothing too weird, nothing too fancy, cursive and all that. If it's not easily read, then stay away from it. The other thing is your background. You don't want to choose a background that's going to make it hard to read either. This is kind of a good example. You see patterns and stuff going on in the background. It may make it a little bit harder to read. So you want to make sure that you not only pick a good size font, you want to make sure you pick a good color, and you also want to make sure that you pick a good background. Typically, the general rule is if you pick a light background, you want to have dark font. If you pick a dark background, you want to have light colored font, just to make sure that it's easy to read. Any questions about that? All right, the next thing, you want to make sure that your presentation is consistent throughout. What that means is every slide should look the same. So if you have numbers on one slide, each slide should have numbers. If you have bullets on one slide, each slide should have bullets. Each slide should have the same type of bullets. You shouldn't have diamonds on one slide, circles on the next slide, squares on the next slide. It should look clean and consistent and professional. Again, same thing goes with the font. You don't want to have, Times New Roman on one slide and then on the next slide have a different type of font. Should all be the same, should be consistent. Any questions about that? Pictures. You guys kill me with pictures. I don't want picture overload. You shouldn't have a slide that has 3 or 4 pictures on it. Does anybody know why?
Because it takes away from the word.
Yes, you're distracting your audience. We're here to listen to you present about XYZ topic. If you have all these pictures, I'm going to start paying attention to the pictures and stop listening to you, right? So I'm totally okay if you don't have any pictures on your slides. If you choose to have pictures, let's keep it at 1. This is a little bit too much. Any questions about that?
No.
Now, along the same lines, some people want to have, all of the different slide transitions where they dissolve away or it comes in a circle. I really don't care about any of that stuff. If I'm presenting to my CEO, he doesn't care about that stuff. He just wants the information. If you want to put it in there, fine, but don't feel like you have to make an extra effort to do all that stuff for me because I'm just black and white. Like, I just want to see what you learned and what you're talking about. Again, music. Some people try to include music. It's really not necessary. I've had students that include music, and what happens then is you have to speak over it. It's another challenge for you as a presenter. You're up against the music. So no music is totally fine with me. All right, any other questions did I answer your questions? You sure? Any other questions about presenting or group projects? Keep it simple.
Is there only one person going to be presenting for each group?
No. As a group, you will be presenting.
Oh.
So what you probably need to do is, after you've done your presentation, decide who's going to speak on what part. Ideally, you would think that whatever part you contributed would be the part you speak about because you know most about it, right? Yes, ma'am.
How many slides do you want on that session?
I can give you a number if you want.
Yeah.
I don't have one.
Oh, no.
If you want one, I can give you one.
15
You
minutes,
want
right?
the presentation to be like 10 or 15 minutes.
Yeah, the presentation should be 10 to 15 minutes. So what that means is if you have 20 slides, you're probably going to take longer than 15 minutes, which is okay. But what I don't want to see is you have 3 slides and you're done in 5 minutes. I think it makes it more difficult for you guys for me to put a limit on how many slides you have, because then I'm limiting how you talk or how you present. And I want you guys to be comfortable in presenting however you want to. If you take 10 minutes, fine. If you take 20 minutes, fine. But I feel like if I give you a number of slides, then you're either going to take your time and go slow through them, or you're going to rush through them to try to get within that 10 to 15 minutes.
But what if we go 15 minutes? Are you gonna do it?
That's fine, no. As long as you're not taking an hour, but I doubt you guys will.
I don't think you have any desire.
Any other questions? I thought somebody else had their hand raised. If you have any other questions, email me, call me, stop by office hours, but those are some of the common things that I see over and over in presentations that are wrong for me. Now, what you do in your other class is fine, but I wanted to talk about that a little bit so that you guys can have an idea about. To your question, what I was saying was everybody should be speaking at some point. Like I said, hopefully you're going to speak on the part that you contributed to the project, because it'd be kind of silly for you to stutter over somebody else's part. So whatever part that you add to the project is probably the part you should speak to. It may help to rehearse at least once before you present, just so you know that who goes before you and who goes after you, so you're not up here fumbling around trying to figure out who's going next. Any other questions? Once again, each team will have one person submit the presentation to me, and it should be in by the time you guys come to class, the day of the presentation. And there'll be a rubric so that you can see how you're going to be graded on the presentation, but it's basically content, how your presentation is organized, your presentation style, in formatting and grammar, and then the 5th component is your peer evaluations that each of you all will submit on your own. We done with that? Now we're talking about quality. Anybody know about healthcare quality? A little bit? No? The Institute of Medicine is an organization that focuses a lot on quality of healthcare organizations. And basically they found that the better quality that we have in our healthcare organizations obviously is going to improve outcomes of patients and improve patient care. So it's something that the whole organization is kind of centered around high quality healthcare, providing quality care. Donna Bedian is basically considered to be the founder or the father of healthcare quality. And his belief of quality was that there is basically 3 components: structure, process, and outcomes. So structure is obviously the structure, the healthcare organization, the staff, the facility. The process is actually the act of providing the quality care. And the outcomes, obviously, is the outcomes. Are the patients being discharged better than they came in, or are they leaving with an infection that they didn't have when they came through the doors? So, within quality, we have 4 parts. You have your technical management, your interpersonal relationships, amenities of care, and ethical principles guiding care. So technical management might be your actual tools or resources that you're using to provide quality care. So an example of this might be physician office that's still using outdated imaging systems. So maybe they're still using the antiquated x-ray machines. Well, that may not be providing the best quality of care, because we now have high-tech imaging systems that may provide a clearer picture. So, a more recent or newer piece of imaging equipment might find that fracture in your leg that old school x-ray machine might not. Interpersonal relationships. We often know that your relationships with your staff can sometimes affect the quality of care. you have two nurses that aren't talking to each other for whatever reason, they're arguing, it may very well affect the way that they're providing care to their patients. So it's very important to note that interpersonal relationships can directly affect quality of care. Whether that be, your coworker, whether that be your bad relationship that you have with the doctor, or whoever it may be. But everybody has to work together for us to have positive outcomes. Amenities of care. Now you've all seen some offices, we'll take dentists, because I see a lot of variations in dentist offices. You'll go in some dentist offices and all the equipment and the office is old and it smells funny, or you'll go to another office, everything's clean, everything's up to date. The chairs in the waiting room aren't about to fall apart. So amenities of care is definitely important when we're talking about quality. And ethical principles guiding care. Well, that pretty much speaks for itself. Each person providing care is obviously going to have their own morals and ethics. And depending on what type of ethic beliefs that you have, may affect the type of care that that patient or customer or whatever it may be may get, right? If you don't believe in doing blood transfusions and you have to do a blood transfusion on a patient, you think you might do the best job that you can do? A lot of times when we have to do things that we don't want to do, we don't do a good job at it, right? If I want to write that paper, if I have to write that paper and I don't want to do it, I'm probably going to turn in something that's not as good as it could have been if I wanted to do it, right? So the same thing applies here. So we have to make sure that we consider the ethics that goes along with providing quality care too. So two important questions in quality that are often asked are the right things being done? That goes along with effectiveness. The second question is, are things done right? You see the difference between the two questions? Do you think that we can have yes to one question and no to the other question? You say yes?
Yeah.
All right, give me an example. Well, you said yes too.
Like, say, disposing of something.
All right.
Okay, we'll say like the needle, like it's being thrown away, but it may not be thrown in the right spot.
Right.
Yeah, that's true.
Which means that we have to have yes to both of these. We can't have yes to one and no to the other one, right? Because that's a good example. We can say, are the right things done? Yes, it was thrown away. Are things done right? If it wasn't thrown away in the sharps container, it wasn't thrown away the right way, although it was thrown away. So it's very important when we're talking about quality that both of these are done. It has to be effective and efficient. Because we could be talking, life and death. If the sharp, or the needle is thrown away in the wrong place and somebody gets pricked and they're affected, depending on whatever's on that needle,
Right.
it could be life or death. Why is quality important? It's important because we only have one life to live. We only have one mother, one father, one sister, one brother, and all it takes is one error or one breach of quality to cause somebody to not be alive anymore. And these are a few different ways that quality fails. So the first thing we have is underuse, which is a failure to provide a service whose benefit is greater than its risk. The example they provide here is the underuse of a beta blocker prescription after the first heart attack. Does that make sense to you guys? So sometimes not providing enough might cause us to, lack in quality. The next example is overuse. Use of service when risk outweighs its benefits. Can anybody give me an example of overuse? Sleeping pills? Some people have died, right?
Yeah.
Painkillers are a big one right now.
Painkillers, definitely. And the third one,
X-rays, MRI.
oh yeah, all the time. We need an X-ray, we need a CT scan, we need a CAT scan, we need all types of scans. Misuse. Risk service is provided badly, reducing benefit to patient. Misuse, example of that would be errors, different types of errors, whether it be prescription error or the wrong notation in the medical record, all those fall under misuse. So I'm gonna pose a question to you guys. Which one of these is the worst?
Misuse.
Misuse. Tell me why.
Reason why I believe is because when you misuse drugs or say somebody giving orders to somebody else, it can cause death or serious injury.
All right. We have any debate here?
I think overuse and misuse is basically the same thing.
Are they the same?
I mean, because
They're not the same.
if you're overusing something, you're misusing it.
They're not the same. Can somebody tell why? Or provide another example?
Misuse is a mistake. Overuse, you constantly make that mistake.
Yeah, that's pretty good. Think about it like this. Misuse, let's take a drug, sleeping pill. Overuse might be using too many. Misuse might be giving you the wrong one. Or not even giving you a sleeping pill, giving you a diabetes pill instead of a sleeping pill. Does that make it more clear now? Overuse could be a form of misuse, but it's not the only case. So back to my question, which one does everyone agree with Allison that misuse is the worst? No takers?
Yeah, I think misuse, like if you annotate something on somebody's medical chart, like, I don't know, you're supposed to amputate the right leg and you put amputate both legs, whatever. That's kind of a big screw up.
That is a big screw up.
That's
I
kind
would
of
say
passive.
overuse because
Here we go, overuse.
antibiotics, if you overuse them, you become immune to them.
Anybody else?
I say underuse.
Underuse. Nice. All right, let me hear it.
I mean, because if you misuse, you fail to provide that correct service. And if you overuse, you still fail to provide correct service. I don't think it's underuse. They all tie under underuse.
All right. Anybody else? They're all very important because they can all cause death, and they all happen in hospitals and physician offices. All these probably happen every day. So, they can all be pretty crucial. Underuse. I think underuse is probably one that goes under the radar. And so it might be the most deadly one because, especially now where people are looking to cut costs, people are looking to cut corners, trying to see where they can pull back on and what they don't have to provide to the patient so they can save money. So this one's going to become pretty important. However, so is this one because, again, we're talking about cost. People are losing money. So as you said, they're going to be telling you to take more tests, do more x-rays because they need money. So this one's important too. This was just as important. Last week we talked about information technology, transitioning over from paper to medical records. This one's gonna happen a lot, right? As people transition over and all that information has to be keyed in, as people are starting to learn how to use the systems and they're not comfortable with it yet, errors are gonna occur. So all of these are very important in quality and none of them should be overlooked. We have to have all of these on the radar because they're all important. And they, like I said, they all probably occur at some point every day, unfortunately. So there was really no answer to my question. I just wanted to see you guys debate. So, has anybody heard of the BALDRIGE award criteria? It's there's a program called the BALDRIGE National Quality Program, and it's a pretty high honor. So if you were to go on a hospital's website and see that they were a BALDRIGE award recipient, that means they're they're doing pretty good. And basically, the award looks at these criteria. So they look at the strategic framework of the organization. Now, we talked a little bit about strategic framework and organization's mission, vision, and values. So for this award criteria, they're looking at your framework to see, is quality included in your mission anywhere? Is it your mission to provide high-quality health care to your patients? Or is quality included in your vision? Is your vision involved becoming the premier healthcare organization in quality in the years to come? Or is it listed in your values somewhere? So they're looking at the strategic framework first. They're looking at the structure of the organization. So they're looking at the leadership. Does your hospital CEO emphasize and encourage quality throughout your organization? What type of strategic planning are you all doing to move towards becoming a better organization that provides better quality? And what's your focus on patient care? When your patients walk through the door, do they automatically feel like they're going to receive high quality care? They look at processes, how you're actually doing things. What's your staff's focus? Does every staff person wash their hands before they enter a patient room? So they're observing how you all provide services. What's your process improvement? If you found ways that your quality is lacking, what have you done to try to improve that? You'll find that a lot of hospitals now have their own separate quality department. Smaller hospitals may not, but middle to high, large hospitals now have quality departments, and that's all they focus on is the quality metrics and the processes of the hospital to make sure that the patients are receiving good care. They also look at outcomes, which is, what it says, outcomes. So, and I think I pulled this up on Cape Fear's website one time. I looked at some of their quality outcomes. So the BALDRIGE criteria also looks at how your patients are doing. Are they leaving the hospital in a better shape than they're coming in? How fast are you providing those beta blockers to those patients that come in with heart conditions? And so again, the award looks at all of these things, and if the hospital is doing well in these areas, then they receive the award. And like I said, it's a very prestigious award to get for hospitals. So if you're looking for a hospital or you have a family member that needs to go somewhere and you see this on the hospital's website, and most hospitals will boast about this, so they'll have it somewhere where you can see it, then you know that it's a pretty good hospital. So this figure is from your book, and it gives you an idea as to the BALDRIGE criteria, as we just talked about. You have the leadership here, strategic plan, focus on patients, staff focus, process management, and the end results. So what are some common elements of quality? If we think about quality, there has to be a way to measure it. We can't just say, oh, they're doing pretty good, they're providing good quality. It doesn't stop there. You have to be able to measure it. So within measurement, you have definition, reliability, and validity. Can anybody think of an example of definition?
Like how many people they see a day?
All right, we'll go with that. That's a fairly good example. So we'll say patient volume. We're going to look at, well, actually, let's change that up a little bit. Let's do patient discharges. That's going to be our definition. So we're defining how many patients are successfully being discharged each day from the hospital. So our reliability, if we're testing this or we're measuring this, what would our reliability be? We would need to make sure that the thing that we're testing is something that's reliable.
The employees?
Meaning, if we're measuring the discharges, we need to make sure that that's something reliable that we can measure. And the way that we would know that is, okay, discharge is something that happens every day. So we're pretty sure that's something we can measure. You don't want to try to measure something that may not happen regularly enough. It may be something that's, that was an outlier or something that doesn't normally happen. So it's important to make sure that the things that you're measuring is something that occurs regularly. So discharges is something that occurs pretty much every day. Somebody's gonna go home, right? The next thing you wanna check for is validity. Does anybody know what that is?
To make sure it's really happening.
Right.
Validate.
Yeah, you wanna make sure that the thing that you're measuring is valid. You don't wanna measure something that's not valid because it may skew your results, right? And so a lot of times when they're looking at different elements within quality, these are the 3 things that have to be checked off. You have to be able to define it, you have to make sure it's reliable, and that it's valid. Does that make sense? Was it a little confusing? Do you need another example or no?
Like your wait time can be measurable too?
It could be, but remember, if we're thinking in terms of quality, and wait time is something that's measured and looked at, but if we're thinking about quality of patient care, they're probably going to be measuring things like infections, falls, discharges, surgeries, or prescriptions. Those are the types of things that are directly related to patient care. So those are the types of quality metrics that would be measured. So, we've measured, we found the quality metrics we want to measure. We're done, right? No, we're not done. Quality is something that continues to happen or should be continuing to happen. You can't assume that once you've identified a problem and you fixed it, that's it. You have to continue to improve that, or even if it's not that, there's always something else that needs to be improved. And so continuous process improvement relates directly to quality because, again, you want to make sure that you don't just stop at a certain level. You want to keep going so that you can continue to provide that quality of care for the patients. So within the continuous process improvement model, there's 5 dimensions. You have process focus, customer focus, database decision making, employee empowerment, and organization-wide scope. So basically what that says is all 5 of these need to occur in order to have the continuous process improvement. So you need to be focused on whatever the process might be, but you also have to have your customer focus. It typically helps to have a decision-making model that's data-based. What that means is you have some way to document and identify what you're doing. So if we use your example of discharges, hopefully the hospital has a system in place that's counting the discharges so that we can be able to measure it and continue to improve it. Employee empowerment. Providing quality care is a lot easier when you have everybody on board. When you have employees that don't care either way, they're just coming in to do their shift and leave, then it makes this kind of stuff a lot harder. So it's always important to make sure you have employees on board and that they're feeling empowered to the point where they feel like things they do affect the quality of the hospital. And that goes along with the organization-wide scope. You can walk in some hospitals and you'll see they have signs about quality and patient care, and then you'll walk into other places and it's, nowhere to be seen. Those are types of organizations that have that organization-wide scope. They've shown everybody that quality is important to their organization, that they have their mindset on providing high-quality care. And so those are typically the type of organizations that are doing this continuous process improvement. So we have a model called the PCDA. Has anybody ever heard of that? Plan, check, do, act. And it's a model that helps you to find problems, try to figure it out, and then implement it. So the focus, which is basically the same thing as the PCDA, the F is find, the O is organize, the C is clarify, the U is understand, and the S is select. So let's take an example. Somebody give me another quality example, and we'll go through the model. Any example?
Surgery.
What was it?
Surgery?
All right, surgeries. We'll say that our surgeries, we're having too many surgeries with complications. That's gonna be our problem, right? That's gonna be our F. We've identified the problem. We're having too many surgical complications. So next step would be organize. You gotta figure out a way to attack this problem. So we're gonna put together a team to work on this issue. Probably a team from where? Surgery department, right? So then the next step will be to clarify. We're gonna figure out what tools or resources we need to try to really identify and get into the nitty-gritty of what the problem is. That might include looking closer at the surgical utensils that are used. Maybe they're not clean. We need to look at the staff to make sure that they're washing their hands. We need to look at the physicians to make sure that they're taking all the precautions that they need to do. That's all in the clarify stage. Understand, all right, we found our problem, we've organized our team, we've figured out ways to look at the problem, understand, all right, so moving forward, how are we gonna measure and collect this data to see if our surgeries are getting better? So that's what would happen at this stage. And we might say, okay, every day we're gonna document some type of way how many successful surgeries we had and how many had complications. And then the selection would be, after we measured, we select what process we're gonna use to implement whatever those improvements are. So let's say that after we collect the data, we found that it was the utensils. Okay, maybe we need to revisit our vendor to get new utensils, or maybe we need to purchase a new sterilization unit. Whatever it may be, this is a step where we would implement that improvement happening in the surgery department. That make it a little more clear? Mm-hmm. So as we talked about, we also have the Plan, Do, Check, Act, which is basically the same thing as focus. The P is plan, the D is do, the C is check, and the A is act. Plan, we're creating an implementation plan. The do is us actually doing the plan. The check is evaluating the measures. And the act is us implementing whatever we found from the measurements. Six Sigma. Has anybody heard of Six Sigma?
I have.
You have?
Yeah.
What have you heard about it?
Just real vague stuff because my brother-in-law's, I think he has a degree in it.
Is he an engineer or?
He's in the military.
Okay. Well, Six Sigma is not something that's specific to healthcare. Actually started in other industries before it came over to healthcare. It deals a lot with quality. So I can very well see that being something that was in the military. It's a certification that you can get, which is what you're probably talking about. They have different levels of Six Sigma. The highest level is the black belt.
Yes, okay.
Yeah.
That makes sense.
And so once you get the black belt of Six Sigma, you're doing fairly well. You're in high demand as far as jobs go. But basically Six Sigma deals with doing less with more, or doing more with less. So figuring out ways to cut costs but still provide high quality. And that's the main reason why I came over to healthcare, is because we're facing tighter reimbursements, and so organizations were looking to figure out how they can still provide high quality with less money. And so now, like I said, people certified in Six Sigma are in pretty high demand in pretty much any industry as well as healthcare. To be able to implement something like Six Sigma in an organization, it's a huge undertaking because it involves a lot of change. And so you have a lot of resistance from people who are used to doing things a certain way and now having to do things totally different because we're trying to do more with less. So it requires that you have really strong leadership, somebody who supports the Six Sigma Act. I've seen situations where people have had Six Sigma consultants come into hospitals and try to help them with their efficiencies, and it just didn't work because the leadership wasn't really involved. It wasn't necessarily that the leadership didn't support the initiative, but they just weren't involved. And because of that, it kind of suffered. There was a lot of resistance, and hospital probably wasted their money because nothing really got changed. But if you're an organization that's able to embrace this, it can really, I've also seen hospitals that embrace this and saved a whole lot of money because they cut out a lot of waste, things that they were being wasteful about, and they were able to take that money and put it other places and provide, other amenities for patients that they weren't able to before because they were just wasting money. And Six Sigma deals a lot with waste and cutting waste and basically going in to figure out ways that you're doing things that are wasteful and how you can change what you're doing to save time, money, whatever it may be. I've even seen Six Sigma be used in emergency departments to try to cut down on wait time because employees were being wasteful with the way they were doing things and was wasting too much time, and as a result, people in the waiting room were just sitting there hours and hours. So you can apply the Six Sigma to pretty much any department in a hospital if you're trying to reduce something, whether it be money or resources or staff or whatever it may be. So we have another acronym, DMAIC. This one, the D is for define, the M is for measure, the A is analyze, the I is improve, and the C is control. Let's take another example. Anybody else have an example? Thinking in terms of quality. Nope. What was it?
Cafeteria.
What was it?
The cafeteria.
Cafeteria food?
Mm-hmm.
All right, we can work with food quality because a lot of times the food will arrive cold or too hot, which can, be some sanitation issues. So,
You don't get what you ordered.
you don't get what you order. If we define our scope of work and time frames for completion. So if we were going to look at the food services department, we could say, all right, we're going to evaluate the food services department for 1 week. So that would be our define. The next would be measure. What are we going to measure?
Sanitary.
Sanitation, food. All right, but how are we going to measure it?
How they're handling
How do you measure that?
it. Yeah, washing hands, gloves.
All right, so but how are we gonna measure it? Are we gonna count how many people wash their hands? Are we gonna count the box of gloves on Monday and see how many are left on Friday? Remember, when you're measuring something, it has to be something tangible that you can count, that you can grasp. It can't just be something very general. So what are we gonna measure?
Washing their hands.
Washing their hands. We're gonna document. Okay.
Yeah, because they have to go to different floors and stuff.
Okay. All right. And then analyze. So we're gonna measure hand washing, and then how are we gonna analyze it?
Breakfast, lunch, and dinner. Break it
How
down
many people
by
did
groups they
versus
go.
didn't?
Okay, we can do that. How many people washed their hands versus how many did it? That's what we'll analyze. Okay? Improve. How are we gonna improve it? Let's say we find that 50-50. We have 50 people, hopefully that's not a real statistic. We have 50 people, 50% of people washing their hands in food services and 50% that aren't. How are we improving that?
Put gloves on their car or sanitizer on
They
their
put
car.
signs up, signs.
Okay, we can put signs up, gloves. I like that one.
Need to educate the ones that aren't washing.
Educate. Okay.
You lose your job, you don't watch.
So you want to reprimand. All right, we can reprimand. Reprimand. All right, so those are all go under improve. And then control, which is very important. Control might be the most important because what you don't want to happen is you do all this work going through all of these steps, and then next month we have the same issue again, right?
Right.
So how are we going to control it?
Recommend.
Reprimand.
Then we go back to your reprimand. Are we gonna warning first time?
Yeah.
Second time,
put you on blast.
It's only one warning.
Right
Hard.
Hardcore.
One warning.
So second time you're fired.
Second time right up, maybe.
Yeah.
Second time write up.
First time is a write-up.
No, first time.
So you
it's a
want to give a
verbal
oral
warning.
warning?
A
A
verbal
First
verbal
time it's a
warning?
verbal
I'm not
warning.
working for you.
I
The
know.
hospital.
Put them on a bulletin board. This
Sanitation,
is
you
who
should know
washed their
these.
hands.
Put them on the nasty.
That might work. Public exposure.
Yeah, put them on
Yeah.
the nasty list.
Yeah.
The hospital, you should know these protocols.
Yep.
So we're going to
Yeah.
control through reprimand, public exposure.
Right up, so mean.
And
Don't
then
wash your hands.
termination if they don't.
I know, right?
No. First warning.
All right. That was pretty interesting. So, we've talked about quality and why it's important. And, you may leave saying, okay, but how do we actually implement these things? So these are some tools that you use, in the quality process. So we have data collection. Data collection is very important because you can't measure something or evaluate it or analyze it if you don't have any data. We can't reprimand the food services department if we haven't counted how many people have washed their hands and how many have not. So the data collection stage is very important. You want to make sure that you're collecting good data, like we talked about, tangible data, not just something that's general, saying that, oh, I think about half of the people wash their hands. That's not good enough. We need to see actual numbers that you've, ticked off or counted the number of people that are washing their hands. Now, you can use that through a check sheet, which is something basic you can create. You can go in Microsoft Word or something, create a little table and check off. You can use charts, which is a little bit more fancy. And if you get really fancy, you can use workflow diagrams, which you can find templates for online. You don't have to necessarily create from scratch. Process mapping is another way. I see this a lot in places with weights. So physician offices, this is very popular. People will use flow charts, and what the flow chart does is pretty much document the patient from when they walk through the door to when they leave. So a flow chart might involve the patient coming in, going to the front reception desk, sitting down, going to the first room, usually to get your weight taken and all your blood pressure, and then going to the next room where the examination room where the physician comes in. And so the end product that you would have from a flow chart is an actual flow chart that shows everywhere that the patient went. And what you'll find sometimes, in some situations, what I've seen is patients will make a complete circle, or they might make something that makes no sense, where they've gone from here, all the way back here, back up here, over here. And you want to make sure the patient has the best experience possible. So you don't want them to feel like they're just running around the whole building. And so what a flow chart does is show you that. Is the patient having a good experience, or are they having to go to 10 different rooms when everything probably could have been taken care of in 2 rooms? So process mapping helps, again, with places with weights, like physician offices or emergency room, waiting room, and places like that. And then you have a process analysis. These are a little bit more sophisticated, and these typically are used in larger scale projects, whether it be, we talked about surgeries. For a surgery project, a surgery department project, you might use a process analysis tool just because it's a little bit more sophisticated. One type is a cause and effect diagram. Basically shows you, if we would take our surgery department example, what the cause of the surgery complications were and what effect that has on the patients, on the department, on the organization. And then another example is a Pareto chart, which is another type of sophisticated tool that's used in quality improvement. So I'm pretty much done with talking about quality today. Anybody feel like they learned something?
Mm-hmm.
Quality is going to become more important in healthcare because more information is becoming transparent, meaning patients and customers can pretty much go online and see almost anything. They can see how well their physician's doing, how well they're ranked against other physicians, how well hospitals are doing. And so kind of like what you were talking about with public exposure, the same thing goes for hospitals. If patients are able to go on there and see that the hospital's hand washing rate is 75% rather than 100%, the hospital should be concerned. And what's starting to happen is that the federal government is becoming more involved in quality, and hospitals with lower quality are suffering because of it. The government is starting to reward hospitals that are having higher quality. So this is something that, while it's, may not be as mainstream right now, in the years to come, I would say in the next 3 to 5 years, this is something that's going to become very important. I've even seen hospitals start to provide bonuses and compensation to physicians, to the physicians that provide really good quality, that have good quality outcomes. So this is something that's definitely going to be important to future healthcare managers like you guys. Any questions about anything? All right, I will see you guys on Thursday.
About the grievance side of that, do you want us to come up with a brief backstory